We're starting to reopen parts of the economy, and that's welcome news for everyone. But as we start loosening some restrictions, we also have to strengthen other measures so that we don't lose the progress we've made. As some people start heading back to work, testing and contact tracing is crucial. That's why we've been working with the provinces and territories to ensure that they have everything they need to keep people safe and healthy. And today, we're taking an important step forward toward containing the virus and safely restarting the economy, led by the Canadian Digital Service and with the help of Shopify, BlackBerry, and the Government of Ontario. We've been working on a nationwide mobile app that will notify users if they've been exposed to COVID-19. We will soon begin testing this app in Ontario. There are already a number of other provinces, including BC, who are working with us on this, but it will be available to everyone in the coming weeks. Premier Ford will have more to say on how the app will work in Ontario later today, but I want to thank him and his government for their leadership and partnership. Now, I want to stress that this app will be completely voluntary. It'll be up to individual Canadians to decide whether to download the app or not. But the app will be most effective when as many people as possible have it. Here's how it's going to work. If you test positive for COVID-19, a healthcare professional will help you upload your status anonymously to a national network. Other users who have the app and have been in proximity to you will then be alerted that they've been exposed to someone who's tested positive. The notification will encourage them to reach out to their local public health authorities. At no time will personal information be collected or shared, and no location services will be used. The privacy of Canadians will be fully respected.
Today, we are moving one step forward in our containment of the virus and the reopening of our economy. And this is led by the Canadian Digital Service in cooperation with Shopify, BlackBerry, and the Ontario government. And we are developing a mobile app throughout the country which will inform all users and determine whether they have been exposed to COVID-19. The app will be soon tested in Ontario, and several provinces, including BC, are working with us, and the app will be made available throughout Canada over the next few weeks. This app will be entirely voluntary, not compulsory, but the more people we use it, the more people will download it, the more efficient it will be. Here is how it's going to work. If you test positive at COVID-19, a health professional will help you upload anonymously your status on the national network, and all the users who have the app and who've been close to you will be alerted to the fact that they have been in touch with somebody who's tested positive, and they will be encouraged to get in touch with the local health authorities. But no personal individual information will be shared, and no system will be used in order to detect where you are, geographical location. And for the last few weeks, we've been reopening our economy. However, our restart is fraught with difficulties for several sectors. I'm talking about the cultural industry. And from the beginning, our government has had the backs of artists and all the workers in this area. And the Canada Council for the Arts is estimated to $2.5 billion the amounts given to the arts and cultural sector through the Canadian Emergency, the CERD, and other benefits. And we've been also helping sports, and today we are opening an online portal to speed up these requests, and people will be able to apply on the government sites for such benefits. we are moving forwards, but we know that there is a lot of work to do. And over the last few months, our museums has lost a lot of income, which is a threat to the jobs of many people. This is why our government has decided to invest $25.7 billion additional investments for the purpose of helping 7 national museums throughout the country, because our museums tell our stories, they pay tribute to our artists, and they enrich our communities, and people who work there are protecting our Canadian heritage and enable us to discover the people who brought our country forward.
Closely monitoring the spread of the virus, its impacts on our economy, and making the right adjustments along the way. We're going to keep listening to Canadians and look for other ways to support them as the situation evolves. I'm happy now to take your questions.
Thank you, Prime Minister. We'll now go to the phones first for questions. One question, one follow-up. Over to you, operator.
Thank you. Merci. Première question, Raymond Fillon, TVA.
First question, Raymond Fillon, TVA. You have the floor. You, please go ahead. Thank Mr. Prime Minister, the UNSC, you said Canada is back. But yesterday you garnered less votes than the Harper government did. How can you explain that? Answer. Well, for many years, we do what we have to do throughout the planet for the purpose of defending Canadian interest, whether it be in the field of climate change or whether it be in the help to more vulnerable countries or whether it be gender equality. So Canada, for a number of years, is much more active on the international stage. We would have liked to be able to speak even more effectively by being a member of the UNSC. However, we have taken stock of the positive impact that Canada has internationally. This is not what I was hoping for as a result, but we will keep our commitment and engagement for the future and over the next few years. Follow-up question? You're not answering my question. How do you explain the fact that Canada has received less votes and failed in this attempt to which you devoted a lot of time? So people think that you haven't improved Canada's reputation. Answer. We knew when we entered the race that our 2 competitors, Norway and Ireland, whose representatives I called, by the way, yesterday and this morning in order to congratulate them, had started their campaign 4 or 5 years before we did. We only entered the race 4.5 years ago ourselves. So we were lagging behind and we didn't make it in time. We are certainly disappointed. However, we did a lot of things internationally on the international stage, and that reaped a lot of benefits for Canada and for the world, and we will continue working with our partners and new friends in order to defend multilateralism, because the world is going through a time of instability, world instability.
Obviously, we would have hoped for a different result yesterday. We've worked very, very hard over these past years to deepen our friendships and create new partnerships on really big issues, from climate change to help for the most vulnerable to women's equality to a range of other issues that is moving the world forward in ways that matter to Canadians both here at home and around the world. Obviously, I was pleased to be able to call Ireland and Norway last night and this morning to congratulate them for a well-run campaign and commit to them that we were going to continue to work with them on all our shared values on the world stage. But the reality was coming in 5 years later than them gave us a delay that we unfortunately weren't able to overcome. I was hoping we would, and we certainly worked hard to do it, but what we were able to do over the few years with this campaign was strengthen and deepen many, many ties and the impact that Canada has around the world in particularly turbulent times. We will remain committed to multilateralism, to engaging constructively and positively in the world, because it's something that matters to Canadians, and it also matters to many, many countries around the world that Canada continues to be present and defending multilateralism.
Thank you. Next question, operator.
Thank you. Merci. Next question, Dylan Robertson, Winnipeg Free Press. Line open.
Good morning, Prime Minister. I wanted to ask about the lack of disaggregated data about our economic recovery. Statistics Canada recently suspended its job vacancy and wage survey because its resources are being stretched so thin. That project's existed for for years. It's been much more detailed than the Labour Force survey. Your departments are also not publishing any data on how the CERB, the wage subsidy, or the commercial rent subsidy are being taken up by province or by gender. This recovery differs by region, but it seems like we're flying blind. So I'm wondering if you're going to divert resources so we can actually measure the recovery more precisely.
We know that solid data is the foundation for making the right public policy decisions. This is a very difficult time with COVID-19, where we've had to set up new systems and adjust old systems to better respond, and our focus every step of the way needed to be on getting the help out to Canadians. But at the same time, we've been working closely with Statistics Canada on collecting better data, and we've been working also with the provinces to enable them to get data that is able to be collated at the federal level. We know that we need better data, we need more disaggregated, race-based data, and this is what we continue to work on right now. There's still, as you point out, much improvement to be made, but we are very much focused on understanding how we're doing so that we can get through this even better.
Follow up, Dylan?
And Prime Minister, I wanted to talk about police forces under provincial jurisdiction. The Winnipeg police have shot and killed 3 Indigenous people in recent months. They were filmed last week kicking a man while he was held down. Your Minister, Dan Vandal, said he's revolted by these incidents, that little has changed over 2 decades in Winnipeg, and he said that your government needs to lead the way in combating what he calls police brutality. So I'm wondering what action you'll take beyond the RCMP, and if you'll be pressing Premier Pallister on this in your call this evening.
Last week, and certainly again tonight, we will be talking about our shared responsibility over various police services across this country and the need to address systemic racism that exists in all of our institutions, including all of our police forces. That's why I know that it can't just be a federal issue, although there is plenty for us to do at the federal side. We do need to work with all partners on this. This is why we're going to continue to talk not just about making strong statements about committing to fight systemic discrimination within our jurisdictions, but we're also going to be talking about concrete actions that need to be taken at different levels of government right across the country in order to make sure that racialized Canadians and Indigenous Canadians don't continue to suffer the kind of daily lived reality of discrimination that is all too common. Nous allons parler ce soir encore une fois.
Tonight we'll be holding a conversation with my colleagues, the premiers, regarding the various jurisdictions and our collective responsibility at the various levels of government for the purpose of bringing about the necessary changes. The federal government has a lot to do, but the federal government has also levers which can be pulled for the purpose of moving forward. What we need to cooperate with the other levels of government. This is what we'll be doing, not only to make a commitment to help the situation, but also to decide what concrete action will be taken in order to improve the situation against daily discrimination for some Canadians.
Thank you. Next question, Christy Kirkup, The Globe and Mail. Line open.
Good morning, Prime Minister. Do you believe the RCMP disproportionately uses force against Indigenous peoples, and if so, why?
I think we've seen data that suggests that Indigenous people are at greater risk of mistreatment or excessive force used by police services, including the RCMP, across the country. And that's just a clear and vivid illustration of systemic racism, systemic discrimination that exists within our country and across a range of institutions. We need to work hard to address this, to change the protocols. I've had conversations with the Commissioner of the RCMP on this, and I know I'm going to have the opportunity to speak with provincial premiers tonight on what we can do in various police forces across this country. This is something we do need to address, and soon and rapidly.
Nous reconnaissons que c'est une réalité que
we do recognize that it is true that Indigenous people and racialized Canadians are more often the object of aggression or mistreatment on the part or police brutality. And we need to address this problem of systemic racism, and this is why I've held a dialogue with the RCMP Commissioner, and I will do it again with the provinces in order to better protect people in Canada coming from minority backgrounds.
And Prime Minister, there are now calls for an independent investigation to be launched by your government of the RCMP's conduct, including its use of force against Indigenous peoples. Is your government on board?
As I've said many times, we are going to be taking strong, bold, concrete actions to go at systemic discrimination in this country, and that includes measures within our justice system, measures around policing, but also measures around economic opportunity and community supports. There is a range of things that we need to do to counter systemic discrimination, the lived reality of far too many racialized and Indigenous Canadians who suffer every single day. We need to do much more, and that's why we are working with them to establish rapidly the concrete actions we're going to move forward with shortly.
Thank you. And we'll take one more question on the phone. Operator?
Thank you. Merci. Prochaine question, Marie-Vastel, Le Devoir.
Marie-Vastel, Le Devoir. Good morning, Mr. Trudeau. You'll be having a conversation with premiers tonight where there is systemic racism. Mr. Legault, the Premier of Quebec, rejects the idea that there is systemic racism. And yesterday, Mr. Singh protested yesterday in the House against the fact that there was a refusal to recognize systemic racism in the House. Is this your stand as well? Answer. First of all, I'm very disappointed to see that the Bloc Québécois refuses to recognize the fact that there is systemic racism in Canada. I believe the first step is to admit and acknowledge the fact that there is a problem. And I hope that the Bloc Québécois and other institutions at various levels of government will acknowledge the fact that there is systemic racism in order to address it. Now, relative to as to what Mr. Singh stated, it's not for me to tell a racialized Canadian that he should not make people ill at ease when he makes statements regarding racism and discrimination. Too many Canadians are the victims of racialization and racism. So this is a critical conversation for us to hold if we want to move forward as a country.
It is disappointing that the Bloc Québécois continues to refuse to accept that systemic discrimination, systemic racism exists within our country, in every part of our country and in all our institutions. Recognizing systemic discrimination is the important first step towards being able to address it and ensure better opportunities, outcomes, and lived realities for racialized Canadians and Indigenous Canadians particularly. In regards to what Mr. Singh said, it is not for me to criticize any Canadian, particularly not the only racialized leader in the House of Commons, for making other people uncomfortable by calling them out for not recognizing systemic discrimination. I think we need to recognize that these conversations are going to make people uncomfortable. But it has been the lived reality of racialized and Indigenous Canadians for far too long. And we need to continue to move forward in a way that attempts to bring people together, But yes, we are going to make some people uneasy with recognizing things have to change.
Suivi, Marie?
Oui, merci. Et donc,
Thank you. So you're disappointed to see that Bloc Québécois continues to reject and refuse to recognize the existence of racism within institutions. And how about Premier François Legault? Answer, well, many people are at the moment at various stages of recognizing the existence of systemic racism in our country. Our task is to bring together people who want to recognize this and to convince other people and to keep moving in the right direction. And we hope that everybody will acknowledge the work we have ahead of us and start working.
The country who struggle with the idea of systemic discrimination, but the sooner we recognize that it exists and that we need to move forward together, the more we listen to the lived reality of racialized Canadians, of Indigenous Canadians, the more we understand the challenges that are being faced every single day in our institutions, in our country, the more we are going to be able to address them and improve our country and actually be more the country that we all know we want to be in our hearts.
Bonjour, Monsieur Trudeau. Christian Noël de Radio-Canada.
Christian Noël from Radio-Canada. Even in countries where contact tracing is very popular, only 40% of the population use them, whereas 40% is below the threshold of effectiveness. It has been also given up in the UK. So what makes you think that Canadians will also will subscribe to this new app and that it will not be a failure in our country? Answer. Over the last few months, the experiments that were carried out were based on apps which existed, which had to remain active on your phone in order to keep functioning, and that would use too much energy from the phone battery and was too complex to use, and it was complicated. Now, this is based on an app which has been developed by Apple and Google within their operating system, which enables us to upload the app and to forget about it. We do not need to do anything in order for the app to operate from our phone. And if you test positive, well, they will anonymously create a code, an anonymous code, that will warn people who've been close to you, in close contact with you, and that's all, without telling who you are. And then these people can get in touch with health authorities. This is a very simple app. We learned the lessons of what people did throughout the world, and we know that these are things which, this is a simple app, it is completely anonymous, it remains completely voluntary, only users who want to use it will use it, but it will be a very powerful tool, and that will enable us to reopen the economy while enhancing our safety.
That, you're right, didn't really work all that well. Some of the challenges were that these applications needed to sit in the foreground of your phone and therefore drained batteries, and you had to work to keep them active quite regularly. In the past weeks, Apple and Google put out major upgrades to their operating systems that allow this application to work in the background. So you don't have to do anything around this application other than download it. If you test positive, they will plug in a code that alerts any phone that has been close to yours that you have now tested positive. And if you have a phone that alerts you that you may have been in proximity with someone who subsequently tested positive, you can just call public health and they'll work through the next steps that you have to do. It's something you can just download and forget about. And because it's completely anonymous, because it's low maintenance, because it is completely respectful of your privacy, including no location services or geotagging of any sort, people can be confident that this is a easy measure that they can have to continue to keep us all safe as we reopen, as we get more active. This is an approach that we are confident is going to make a big difference, and Canadians can do this and forget about it.
Une des préoccupations des gens, c'est notamment la vie privée. Vous expliquez un peu comment ces données-là vont être protégées, mais j'essaie de comprendre.
One of people's concerns is privacy protection. But where will those data be kept? Will it be on secure servers? Has the Privacy Commissioner been involved in the decisions? And how will you convince other provinces who have reservations to move ahead? We need to think about this in three parts, really. First of all, it's the application component, which will be national and adjusted for each province involved so that people have information on local health services. But the application itself will be the same across Canada. It'll be applied across the country, regardless of whether you're Ontario, in BC, or visiting another province. It'll continue working. Secondly, the register, the data bank, will be held by the federal government and will contain only anonymized data associated with phone numbers where there will be no personal information that can identify the person. It'll be a code that's linked to a positive test, for example, or to the absence of a test.
Contrôlé par les services.
The secure data bank will be controlled by Canadian Digital Services, which is part of the Government of Canada. It will be entirely secure and held in Canada. The third component are the public health services of all provinces and territories, whose responsibilities will be to ensure, in the event that a person is tested, that the code is associated through the telephone number with a positive test completely anonymously. So if someone receives an alert that he or she might have been in contact or near someone who tested positively, that person can then call public health and say, I think I've been in contact with someone who's positive, then what do I do? And public health will provide instructions. It is anonymous, it is stringent. Yes, we did work with the Privacy Commissioner. We worked with BlackBerry and Shopify to find ways of ensuring that all data are private and anonymous. This will be extremely useful in helping us in contact tracing for COVID-19.
The way to think about this app is actually in three different sections. One is the national app that everyone can download that will be customized for each province, but it will be one app that whether you download it and live in Ontario and travel to BC or travel to the Northwest Territories, if that becomes an option, it'll work everywhere across the country. So it's one app for all Canadians, and there are over 30 million smartphones that could take this app in Canada. So we can talk about a significant portion of the Canadian population that could be protected by this app that you can download and then forget about. The second part of it is obviously the national database. There will be a database of randomized codes associated with each smartphone that has this app that will be divided into two columns, those who may have tested positive and those who have not tested positive. So if your phone gets in proximity for a certain amount of time at a certain closeness to another phone, it'll register that it has had contact with that anonymized number. Not a phone number, but an anonymized identifier for the app. A few days later, if that person you were in proximity with tested positive, you will get a notification to reach out to your local health services. So the third part of that app is the local, provincial, or territorial health services that will ensure that when someone tests positive and they have the app is notified that that random number associated with your phone goes into the red column. On top of that, if you are notified that you were, over the past few days, in proximity with someone who then tested positive, you'll be encouraged to call your local health authorities to say, I think I just got an alert that I was in proximity with someone who looks like they just tested positive. What do I do? And the local health authority will walk you through that. And it's completely separate from the app at that point. It's the same thing as if you realize that your grocer that you just had a conversation with 2 days ago suddenly tested positive, and you should probably call your local health authorities. So it's an extra tool that helps people move forward with confidence that we're going to be able to track and trace more of the exposure or the potential sharing of the COVID-19 virus around the country. It is an extra layer of protection that goes on top of everything else we're already doing, and that's why we're encouraging people to download the app once it becomes available in early July.
Hi, Prime Minister Tom Perry, CBC. Is there a level that you're trying to hit in terms of the number of people downloading the app? And if you don't reach that level, is there a plan B?
I think any amount of people that download it will be useful for that person and for our society. But that's certain that if we can talk about a 50% update, for example, uptake or more, then it becomes extraordinarily useful, not just for having people know that, they were in proximity with someone who then tested positive, so they should reach out to public health. But it'll actually allow us to have a better sense of when there are spikes or resurgences of a virus in a particular area or not, because more people will be getting that notification and calling their local public health authorities. So any level of uptake would be useful, but because it is such a simple procedure, you download it for free, you leave it in the back of your phone, and you forget about it until suddenly it tells you, you may have been in proximity with someone who since tested positive, reach out to your public health authority. It's something that we expect that a lot of Canadians are going to realize here is a tangible thing they can do to keep us safer as we move forward in the reopening. Okay. Évidemment, c'est un outil qui va être encore plus utile le plus.
The app, of course, will be all more useful the more people download it. If we can hit a 50% target or higher, it can be an absolute. It can have a transformative impact on reopening. But however many people download it, it will be helpful in contact tracing. But it is so easy to do. All you need to do is download the app, and then you can forget about it. It will then anonymously alert you to say that you might have been in contact with someone who has then tested positive for the virus, and will ask you to call your local health authorities to ask them what to do. That presents advantages for both the individual and society. It's anonymous. There is no location service on it. It's completely under the user's control, and it's entirely secure. So we expect a lot of Canadians to want to do their part by doing this very simple thing. If ever there were an outbreak in a given area, it'll be traced very quickly, because people will be very quickly alerted that they might have been close to someone who has then tested positive.
Get that 50% or higher. Is there a plan B? And I mean, how much more complicated does that make contact tracing?
Contact tracing, as it is right now, is being done with hundreds and even thousands of people across the country who are doing it manually, and that will continue. What this app provides is an extra layer of effort that is removed. If someone has the app and is notified by the app that the person that they contacted with or this person they sat next to in a cafe subsequently tested positive, that prevents that person in the cafe from having to explain, well, I was in the cafe at this particular time, and I think Jim from down the street was sitting next to me. Maybe you should call them to tell them that they might have been exposed to me. The app does that automatically. So it is a layer of additional effort, but it is in addition to all the contact tracing that we're doing right now, all the control we're having. It adds to our capacities in a very useful way if there is strong uptake, but what we're doing as it is continues.
Kevin Gallagher with CTV National News. I just want to go back to yesterday in the House, Prime Minister. I want to ask you, do you think that Alain Terrien with the Bloc Québécois was racist by voting against the motion from NDP Leader Jagmeet Singh that there's systemic racism in the RCMP?
I think it remains problematic that the Bloc Québécois refuses to recognize systemic racism in the RCMP and in this country. The first step is recognizing that there is a problem so that we can address it, and it is unfortunate that they continue to resist recognizing the lived reality of millions of Canadians who are Indigenous or racialized.
But you won't comment on your opinion on what you think that action means. Do you think that that action in the House, by purposely voting against the motion, do you think by that in itself, this is what Mr. Singh is alleging, of course, that in itself was racist?
First of all, that's something for the Bloc Québécois members themselves to explain why they continue to resist recognizing the lived reality of far too many people that systemic discrimination does exist in this country. Secondly, in regards to Mr. Singh, I think it is important that we recognize that racialized Canadians whose lived reality is discrimination and microaggression all too often, are allowed to make people uncomfortable in bringing out these issues. I think it's important that we recognize when the only racialized leader in the House of Commons, makes a statement like that, that it comes from a place that, yes, will make people uncomfortable, but needs to be dealt with as we move forward as a country. Je pense que c'est au Bloc Québécois d'expliquer pourquoi ils ne pensent pas.
I think it's up to the Bloc Québécois to explain why they believe that this lived experience by so many thousands of Canadians, experience of racism and discrimination, does not exist. Why they believe that systemic discrimination does not exist. We need to show that racialized Canadians, like the leader of the NDP, have to face and know full well that there is systemic discrimination in this country. And when they say things that occasionally make people uncomfortable, that is part of a process that we have to go through to understand that there is a problem and start dealing with it together. I hope that the Bloc Québécois will understand that we need to work together to deal with the repercussions of systemic racism. Janet Silver, Global News.
You just announced, and you said that the privacy of Canadians will be fully respected. I'm wondering whether or not the Privacy Commissioner has been involved with this new app, and if he has not, will he be? And also, do you have buy-in from all the provinces?
The Privacy Commissioner has been worked with on this app. It is extremely important that we make sure that Canadians' privacy is protected, not just for their sake, but because we know that uptake of this app won't be there if people are worried for their privacy. That's why it functions entirely on an anonymized basis. There are no identifiers of your phone, of your number, of your identity, of your address, or even of your location that is any part of this app. A random code associated with your phone will be held in a secure national database that will be consulted by the apps across the country to see whether that randomized code has tested positive for COVID or not. If it has tested positive, your phone will tell you that, oh, you've been in proximity with someone who has subsequently tested positive for COVID, so you should probably call your local health authority. That's what it is. It's super simple, it's super secure, and we've worked very, very carefully to ensure that it is that way. It will be available as of the beginning of July right across the country. The app is there. The national database of anonymized data is there to be consulted by the app right across the country. The third part of the app is integration into the local public health services, so that when someone is tested positive, that the app is notified that they are tested positive. That requires working with the provinces on that. We have a number of provinces already moved forward on that. But even if you're visiting a province that does not have the app, you can still make sure that you're being protected, because people who have the app in that province, even if their public health authority hasn't signed on to it, but who are in contact with someone from Ontario who then goes back to Ontario and tests positive, they'll be notified that they had been exposed to someone who had the app. Obviously, it'll work better once all provinces and territories are part of it, because what we've seen from other jurisdictions is when you can have one clear, extremely simple, download and forget about it app that is totally secure and completely anonymized, and yet an extremely effective tool to continue in a safe reopening of our economy, the uptake will be quite high right across the country. Okay. L'application va être disponible à travers le pays.
The app will be available across Canada at the beginning of July. The National Data Bank of anonymized data will be established, will be in place, but what we will need are for the provinces to work with us so that public health care workers will be able to register an anonymous code for somebody who tests positive, so that anyone that person might have been in contact with over the previous days would be alerted and would be notified that they should contact their public health authorities. Even in provinces that have not integrated their own public health care systems into it. Well, let's say somebody's visiting from Ontario and somebody in the province they visit has downloaded the app. If they have been close to each other, if that visitor goes back to Ontario and tests positive, the app is notified. Even someone in the province who hasn't officially implemented the system, but if somebody there has downloaded the app, they will be notified if they've been close to the visitor who tested positive. It will, of course, be more effective once all the provinces have come on board. But even if your province hasn't, it will be useful for you to download the app. So we do expect that Canadians across the country will download the app, and we also do hope that provinces will see how useful it can be in protecting their citizens.
COVID-19. And there are still discrepancies across the country, even within communities, as to where and when you wear a mask. I'm wondering whether or not your government has any regrets that we didn't ask Canadians to wear a mask sooner. And as we head into a possible second wave, what more you can do to encourage people to wear a mask when they go out?
I think in the first months of this COVID-19 pandemic crisis, we were very strongly encouraging people to stay home, to not go out, and to keep very rigidly socially distanced when they did go out for groceries or for whatever reasons they had to go out for. We were concerned, I think public health authorities were concerned that masks could give a false sense of security that might not arrest the spread of COVID-19 as effectively as being properly isolated actually did. But now, as people are re-engaging in society, as we have succeeded in flattening the curve, there is more opportunity for people to go out and wear a mask as they do. I think we need to remember that masks do not protect you as much as staying home would, or as keeping a full 2 meters distance from each other, but it is an additional measure that we see more and more Canadians using right across the country in order to keep them safe and to keep their loved ones safe. I
believe that in the early stages of the pandemic, the priority was for people to stay home, because really the best way of stopping the spread of COVID was for people to stay home and not to go out unless it was absolutely necessary. The idea that was that masks might give people a false sense of security, and that was a concern for a lot of people in public health. Now that we have succeeded in significantly flattening the curve across Canada, and certainly in most places, and now that the economy is reopening, people are beginning to go back to work, we acknowledge that the best way of stopping a spread and protecting oneself is staying home and social distancing. But if you are going to go out or find yourself near to people, it is recommended that you wear a mask because it will help reduce transmission, even though it doesn't completely protect you. So do bear that in mind. You will not be completely protected, but more and more people are wearing masks when they go out in public or when they have to be close to one another, or they go out and take a mask with them, put it on when they go into a shop. That is the kind of behavior that will help you continue fighting COVID-19. Thank you, everyone.
All right.
Bonjour et merci de vous être joint à nous aujourd'hui.
Good afternoon and thank you for being with us
Today,
today.
we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer of Canada, Dr. Howard New, the Minister of Indigenous Services, Mark Miller, et le Ministre du Patrimoine canadien, Stephen Guilbeault,
Minister for Canadian
and
Heritage,
of
Stephen
course,
Guilbeault.
Indigenous Services Canada's Chief Medical Officer of Public Health, Dr. Tom Wong, is with us as well and available to answer your questions. Dr. Tam, please.
Hello, bonjour à tous. I'll begin with an update on the latest numbers for COVID-19 in Canada. Last night, the usual time at which we update the numbers, we had reported 99,853 cases, but I understand that as we speak, Canada has now exceeded 100,000 cases of COVID-19. These included at least 8,254 deaths, 62,017 people, or 62%, of whom have now recovered. Labs across Canada have tested over 2,254,481 people for COVID-19 to date. Over the past week, an average of 36,000 people were tested daily, with just over 1% testing positive. In parallel with the COVID-19 pandemic, many communities across the country continue to struggle with historic rates of drug overdose deaths and substance use-related harms. Yesterday, we released the latest available national data that showed that we lost, tragically, 3,823 people to apparent opioid-related overdose deaths in Canada in the year 2019. A majority of those who died were adult males, who are our brothers, fathers, friends, and neighbors. From the national data, we saw that the number of deaths were on the decline in the second half of 2019. In fact, the numbers of deaths reported in the last 2 quarters of 2019 were the lowest they have been since 2016. This is a sign that our collective action to address the drug overdose crisis had an impact. Sadly, we're hearing from partners across Canada that overdoses, including fatal overdoses, are on the rise again in many parts of the country during the time of COVID-19. Changes in the illegal drug supply in the wake of COVID-19 may result in increased risk of overdose for persons who use drugs. We know that stigma stops people from reaching out, and using drugs alone is a major risk factor for experiencing a fatal overdose. People who use drugs may be feeling more isolated as a result of the physical distancing measures to control COVID-19. So, now more than ever, we must maintain our resolve to work together to stop overdose-related harms. Reach out to your loved ones, connect with your friends, and check on your neighbors so that they know you are there to support them. Health Canada and the Public Health Agency of Canada are also increasing supports for people who use drugs. We are focused on increasing access to treatment and harm reduction services and reducing stigma in health systems, making it easier for people to access the medications they need, including as a safer alternative to the highly toxic street drug supply. I encourage healthcare providers across the country to learn more about the options that are available to provide care for your patients who use drugs by visiting the COVID-19 and Substance Use Toolkit, now available online at canada.ca. We know there is more we can do to prevent drug-related harms and overdose deaths as we learn to live with COVID-19. Together, we can tackle these dual public health crises and save lives in communities across our country. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New.
Now, Dr. Howard New.
Merci. Bonjour.
Good
Je vais
afternoon.
commencer par vous donner les derniers
I'll begin
chiffres
with
sur
an
le
update on the
COVID-19 au
latest numbers
Canada.
for COVID-19
Comme vous
in
savez,
Canada.
les chiffres évoluent rapidement et
As
se
you
sont
know-
mis à jour
as you know,
une
these
fois par
figures
jour
evolve
en
rapidly
soirée sur
and
le
are
site
updated in the
canada.ca
evening on
coronavirus.
canada.ca/coronavirus.
Selon les données d'hier soir,
Based on
il y avait
yesterday's
99
data,
853 cas confirmés,
there were
dont 8 254
99,853
décès
confirmed
et
cases,
62
including
017 personnes
8,254
rétablies,
deaths and
soit 62% des
62,017
cas.
people,
Mais
or
ce matin,
62%
on sait
who have now
qu'actuellement,
recovered.
on a dépassé 100
Labs
000
across
cas au
Canada have
Canada.
tested.
Jusqu'à ce jour,
In fact,
les
we've already gone
laboratoires
beyond 1
partout au
million,
Canada ont fait passer une test de
100,000
dépistage de la
cases,
COVID-19 à
Labs
plus
across
de 2
Canada have tested over 2,254,481 people
Au cours de la dernière semaine,
for
nous avons
COVID-19
testé
to
en
date.
moyenne 36
Over
000
the past
personnes
week, an
chaque
average of
jour, dont un
36,000
peu
people
plus
were
de
tested
1%
daily,
ont
with just
reçu
over
des résultats
1% testing
positifs.
positive.
Parallèlement à la pandémie de COVID-19, de nombreuses
In
communautés au
parallel with
pays
the
continuent
COVID-19
d'être aux
pandemic, many
prises
communities
avec
across
des
the
taux
country
historiques de
continue to
décès
struggle with historic
attribuables
rates
à
of
des
drug
surdoses
overdose
de
deaths
drogue et des méfaits
and
associés à la
substance
consommation
use-related
de
harms.
substances. Hier, nous avons
Yesterday,
publié
we
les plus
released
récentes données
the latest
nationales
available
disponibles
national
qui
data
montrent que 3
that shows
823
that
personnes
we
sont
lost
décédées d'une apparente surdose
3,823
d'opioïdes
people to
au
apparent
Canada en
opioid-related
2019.
overdose deaths in Canada
Une
in
majorité de
2019.
ces décès étaient
The
des
majority
hommes
of those who
adultes.
died were
Ils
adult
étaient nos
males,
frères,
our
pères,
brothers,
amis et
fathers,
voisins.
friends, and neighbors.
Selon les données nationales, le nombre de
From the
décès
national
a
data, we saw
enregistré
the number
une
of deaths were on
diminution
the
au cours des
decline in
derniers
the
6
second
mois
half
de
of
2019.
2019.
En fait, le nombre de décès déclarés
fact,
au
the
cours
numbers
des
of deaths
derniers 6 mois
reported
de
in the last 2
2019
quarters
a
of
été le plus bas
2019
depuis
were the lowest
2016.
they have been since
Ces statistiques
2016.
démontrent que nos mesures
This is a sign
collectives
that our
pour s'attaquer à la crise des
collective actions to
surdoses
address
des
the
médicaments
drug
ont
overdose
donné des
crisis
résultats.
had an impact.
Malheureusement, nos
Sadly,
partenaires de partout au Canada
we are hearing
nous informent
from
que les
partners across
surdoses,
Canada
y compris des surdoses
that
mortelles,
overdoses, including
connaissent de nouveau
fatal overdoses,
une augmentation
are on
dans
the rise
plusieurs régions
again
du pays en cette période
in
de
many parts of the
COVID-19.
country
Des
during this
changements
time
dans
of COVID-19.
l'approvisionnement de drogue illégale
Changes
durant
in
la
the illegal
pandémie
drug
de
supply in the wake
COVID-19
of
pourraient causer
COVID-19
une
may
augmentation
result
du
in
risque de
increased
surdose
risk
qui pourrait
of
être
overdose
mortel.
for persons
Les
who
personnes qui
use
consomment
drugs.
des drogues peuvent se sentir davantage
We
isolées
know that
en
stigma
raison des
stops
mesures
people from
d'éloignement
reaching out,
physique
and
visant à
using drugs
maîtriser
alone
la
is a major
COVID-19.
risk
Et nous
factor
savons
for
que les personnes qui
experiencing
prennent des drogues
a
ne demandent
fatal
pas d'aide à
overdose.
cause de la
People who use drugs may be feeling more
Par
isolated as a
conséquent, nous
result
devons
of the physical
maintenant
distancing
plus que
measure
jamais maintenir notre
control
résolution de travailler à mettre fin aux
COVID-19.
méfaits liés
So
aux
now more
surdoses.
than ever, we must
Tendez
maintain
la
our
main à vos
resolve to work
proches,
together to stop
communiquez avec vos
overdose-related
amis
harms.
et prenez des
Reach out to
nouvelles
your
de
loved
vos
ones,
voisins
connect with
pour
your friends,
faire
and check
savoir que
on your
vous
neighbors
êtes
so that
là
they know
pour les aider.
you are there to support them.
Santé Canada et l'Agence de la santé publique
Health
du
Canada
Canada
and the Public Health
augmentent
Agency
également
of Canada
les
are
services
also
de soutien
increasing
aux
supports
personnes
for
qui
people who
consomment des
use
drogues.
drugs.
Nous nous efforçons d'améliorer
focused on
l'accès aux
increasing
services de
access to
traitement
treatment
et de
and harm
réduction
reduction
de méfaits,
services,
réduire des stigmatisations dans les
making it
systèmes de
easier for
santé
people to
de
access the
manière à ce
medications
que les
they
personnes
need,
aient plus facilement accès
including
aux médicaments
as a
dont ils
safer
ont besoin comme
alternative to the
solution
highly
de rechange
toxic
plus sécuritaire
street drug
aux drogues
supply.
illicites hautement toxiques. On encourage les fournisseurs de soins de santé
I encourage
de
healthcare
partout au
providers
pays
across the country
à en apprendre
to learn
davantage
more
les options de
about the
soins qui
options
sont offertes
that are
pour
available
leurs
to
patients
provide care for your
qui
patients
consomment des
who
drogues
use drugs
en consultant
by
la
visiting
trousse
the
d'outils sur la
COVID-19
COVID-19
and
et la
substance
consommation
use
de
toolkit,
substances qui est désormais accessible
now
en
available
ligne au
online at
canada.ca.
canada.ca.
Nous sommes conscients que nous pouvons en faire
We know
plus
that there
pour
is
prévenir
more
les
we can
méfaits
do to
liés
prevent
aux drogues et les
drug-related
décès par
harms and
surdose,
overdose deaths
alors que nous
as
apprenons
we
à
learn
vivre avec
to
le
live
COVID-19.
with COVID-19.
Ensemble, nous pouvons
Together we
nous
can
attaquer
tackle these
et ces deux crises de
dual
santé
public
publique
health
et sauver
crises
des vies
and
dans
save
les
lives
communautés
in
partout
communities
au pays.
across our country.
Merci.
Thank you.
Merci, Dr. Kno. And
Thank you,
now
Dr.
we'll
Kno.
hear from Mark Miller, the Minister of Indigenous Services. Mark, please.
Thank you. Sego Kwe, Tanse Ulukut, good afternoon, bonjour. There are a number of things I'd like to address today, and first let me give a quick update on the progress we continue to see in flattening the COVID-19 curve in Indigenous communities. As of June 19th, we have confirmed 263 cases of COVID-19 on First Nations reserves. Of those, 213 have recovered. And I'm pleased to report again that there are no new cases in Nunavik, and all the 16 cases that were noted before have recovered. The flattening of the curve is encouraging and demonstrates that Indigenous communities have been successful in their efforts to stop the spread of the virus. As businesses reopen, as activities resume, and as travel returns, we must remain vigilant. We must continue to take all necessary measures to protect individuals, families, and communities. We must put people's health and safety first. Encore une fois, je tiens à prendre un moment pour
souligner l'importance de promouvoir non seulement le bien-être physique, mais aussi mental. La pandémie de la COVID-19 a eu un impact pratiquement sur toutes les facettes de la vie quotidienne. Nous nous sommes engagés à le faire et nous continuerons de le soutenir dans la prestation des soins de qualité, tandis que les personnes et les communautés des Premières Nations, des Inuits et des Métis prennent les devants pour répondre à leurs besoins. Bien avant le début de la pandémie, la demande des services de soutien en santé mentale était déjà à la hausse. Mais depuis le début de 2020, nous avons constaté une augmentation de près de 200% de cette demande d'aide. Ce chiffre parle de lui-même. Nous savons qu'il faut du soutien approprié et opportun en santé mentale spécifiquement, et nous continuerons de travailler avec les partenaires et les communautés des Premières Nations, Inuits et Métis, ainsi qu'avec les gouvernements provinciaux et territoriaux pour adapter et améliorer les services actuels en matière de santé mentale dans le contexte de la COVID-19, ainsi que pour faire face à la crise actuelle du suicide,
as well as to address the current suicide crisis among Indigenous youth.
Our commitment to support Indigenous communities in their response to COVID-19 has not wavered. To date, the Government of Canada has made $1.5 billion in distinctions-based funding available to Indigenous peoples to support their efforts to successfully battle COVID-19. Notably, a $305 million distinctions-based Indigenous Community Support Fund. Of this amount, $215 million was dedicated to First Nations, $45 million to Inuit, and $30 million to Métis Nation communities, plus $15 million in proposal-based fundings for First Nations off-reserve and urban Indigenous organizations and communities, all of which has been deployed into communities and to those organizations asking for that funding. An additional $75 million was also made available for organizations supporting First Nations individuals off-reserve and Inuit and Métis living in urban areas, as well as $10 million in funding for emergency family violence prevention shelters on reserve and in Yukon. Furthermore, over $280 million was dedicated to support Indigenous Services Canada's health response in First Nations and Inuit communities. This is essential funding that will help to provide First Nations and Inuit communities with additional healthcare providers, personal protective equipment, health infrastructure, specifically retooling of existing community spaces and purchasing mobile structures to support isolation, screening, and accommodations and community-level infection prevention and control measures. In addition, as part of our response to COVID-19, we're also providing $270 million to respond to the financial pressures that COVID-19 has placed on the Income Assistance Program. We also announced recently $75.2 million in new investments to support First Nations, Inuit, and Métis post-secondary and recent graduates impacted by the pandemic, and $440 million in funding to support Indigenous businesses in the tourism industry, in particular in response to hardships created by COVID-19. We're committed to responding to the needs of First Nations, Inuit, and Métis to prevent, respond, and stop the spread of COVID-19. We're committed to getting more nurses and paramedics to more nursing stations and health centers to help those who need it most. I want to take this moment to thank all the healthcare professionals working in Indigenous communities for their dedication and determination to ensure that quality and culturally appropriate care, testing, treatment are provided during this pandemic. They often go above and beyond to make sure their communities are safe and healthy. We would not have seen this level of success in planking the curve without their work. Thank you. But there's also another crucial topic I'd like to address today, and one that we can't ignore, one that shouldn't be dictated by politicians or media cycles, but one that should be discussed and thought about every single day in our homes, places of work, with our friends and family. Right now is a moment when Canadians are recognizing that there's unfairness built into our systems, and that these systems have always been unfair towards Indigenous peoples and racialized Canadians. It seems obvious. We need to ensure there's accountability and that policing services are committed to ensuring that they are always worthy of the trust we put in them. Indigenous peoples and their communities are entitled to the best there is of the RCMP, who've sworn oaths to protect and to serve. And we need to constantly question and reflect on these issues of systemic racism in institutions. My department's no exception, but particularly those who hold exceptional powers of life and death. These exceptional powers exercised by police services across Canada do come with exceptional responsibilities. We must fight to remove systemic racism from these institutions that are meant to serve everyone living in this country equally and fairly. These are difficult and uncomfortable conversations, but important ones to have. While many people will never fully understand the lived experiences of Indigenous peoples, we must stand and speak up in the face of injustices. Advancing our relationship means changing the colonial and paternalistic laws, policies, and practices, and addressing their impacts on the lives of Indigenous peoples. Miigwech, merci cho, nakumik, thank you, merci à tous.
Okay, thank you very much, Mark. Et maintenant, je donne la parole au ministre du Patrimoine canadien,
Minister for Canadian Heritage, Stephen Guilbeault.
Merci, Christian. Bonjour. Depuis le début de la pandémie de COVID-19, notre gouvernement entend les appels du milieu de la culture et du patrimoine. Nous adaptons constamment nos mesures à leurs besoins les plus criants.
The Canada Council for the Arts has estimated that artists, creators, and cultural workers have collectively received over $2.5 billion from the Canada Emergency Response Benefit and the Canada Emergency Wage Subsidy, even before the recent extension of those two measures. In addition, I already announced a $500 million emergency fund for the arts, culture, and sports sectors, bringing the total support of our government to those sectors to $3 billion.
Notre objectif est d'aider un maximum d'organismes afin de les voir sortir de la crise et reprendre leurs activités le plus rapidement possible. Museums play an especially
crucial role in the heritage sector. They preserve our artistic, cultural, and historical treasures and give us a chance to better understand the rich and diverse society in which we live. Since March 14, our 6 national museums and the National Battlefields Commission have closed their doors to help protect our health and safety. Across the country, heritage institutions have also been facing significant difficulties. That's why the Government of Canada is taking new measures to help the museum sector. We're providing $25.7 million to the National Museums and National Battlefields Commission to help them maintain essential services and get ready to open their doors.
Nous entamons également le premier volet de la phase 2 du Fonds d'urgence relatif à la pandémie de COVID-19 pour soutenir les organismes chargés de la culture, du patrimoine et du sport. Un fonds de $500 millions annoncé le 8 mai dernier. La phase 1 est en cours pour distribuer des fonds aux bénéficiaires actuels de plusieurs programmes du ministère et portefeuilles de patrimoine canadien. Avec la phase 2, nous élargissons la portée de notre aide. Nous injectons tout d'abord $53 millions dans le programme d'aide aux musées pour supporter les organismes qui possèdent des collections patrimoniales.
We'll announce other measures in the coming weeks to reach even more organizations across the country. The assistance announced today complements our other support measures. Organizations can find advice online at a new portal of the Canadian Heritage website to expedite their requests. Je sais que les musées ont hâte
de nous accueillir à nouveau et que la sortie de crise ne sera pas facile pour eux. Voilà pourquoi notre gouvernement demeure à leur écoute, prêt à les soutenir. Merci.
Merci, Stephen. Et on est prêt maintenant à répondre à vos questions.
Thank you. We are now prepared to respond
to your questions.
Thank you, Deputy Prime
Minister. Exceptionally, today we're going to start in the room. 3 questions from the room, and then we'll turn to the phone. 1 question, 1 follow-up. Dylan?
Hi there. Minister Miller, there was a spate of Winnipeg police shooting Indigenous people in recent months. We've seen some violent arrests of Indigenous people. Last week, the Winnipeg police kicked and kneed a restrained man. Minister Vandal called this police brutality, and he said Ottawa needs to take a leading role in combating this, including the city police. I'm wondering if you saw that video and if you agree that Ottawa should go beyond the RCMP when it's looking at police brutality.
Well, thank you, Dylan. This country needs to have a national conversation on the use and the spectrum of the use of force in our police enforcement agencies. That includes city police forces, no question. I agree with Minister Vandal. I did not see the video. I've seen many other videos, and this is part of the pattern. We dedicate ourselves to ensuring that there are independent investigations, and we do absolutely need to respect those. But it doesn't prevent us from ensuring there is accountability, ensuring there are national standards that must be enforced and respected, and ensuring there's a review in a timely fashion of an oversight and supervision of those police forces, like I said, that hold exceptional powers. And if there is systemic racism, we need to address it in a concerted fashion.
For a question for Minister Guilbeault, I was wondering about the Canadian Museum for Human Rights. They were screening out gay content when religious schools tour the museum. At one point, they physically blocked a display about gay marriage. You said that this is condoning homophobia, so is anyone actually going to face consequences, and are you issuing any guidance for other institutions?
Thank you. Our government expects national museums to be held to the highest standards of inclusiveness, social awareness, and respect. We are aware of apparent cases of self-censorship of LGBTQ realities at the Canadian Museum of Human Rights in Winnipeg, and are taking this matter very seriously. Let me be clear. An institution like the CMHR should not be perceived as condoning homophobia or engage in self-censorship. Its role is to expose the realities of whose voices have been silenced, not silence them even more. We are in contact with senior management of the museum regarding these allegations and remain committed to promote and protect the rights of LGBT communities in Canada and abroad.
Thank you, Minister. Elizabeth.
Okay. Elizabeth Thompson with CBC. Supreme Court of question for Minister Miller. The Supreme Court of Canada's Chief Justice Richard Wagner is suggesting amendments to the criminal code which could affect jury trials. Now, experts say that Indigenous people are overrepresented in the criminal justice system, and some lawyers fear that tinkering with juries could lead to fewer fair trials. As Minister of Indigenous Services, I wonder, do you have any concerns, and if so, what are they?
As a human being, I have concerns. This is as a member of cabinet. These are concerns that I am going to share not only in my portfolio with the overrepresentation of Indigenous and frankly Black inmates in the criminal justice system. Those reforms are reforms that need to be done in a very comprehensive fashion and frankly in relatively short order. This is something that the Minister of Justice is tasked with doing, and the Prime Minister and the rest of cabinet is very keen in seeing effective. But it has to come with a suite of measures that come on the front end of things, which is addressing social economic disparities, addressing the conditions that put people in jail inevitably, and so. Reform of the justice system is very important. It has to be done in the right way, whether that's re-examining mandatory minimums or otherwise, of course. But we have to do that in a comprehensive fashion, and that's something that I'll be doing with cabinet, and that the Prime Minister has put me in cabinet for and the rest of the members here at the table, for that matter, to ensure that does get down, to make sure that those inequities and those outcomes are properly addressed.
And a question for the three of you who have seats in the House of Commons. There's a lot of talk and a lot of buzz today about what happened yesterday with the Bloc and with the NDP, the Bloc refusing to give unanimous approval to the motion. Wondering if any of you were in the House of Commons when this happened. What did you see? How would you qualify it? And in general, what do you think of that exchange?
Let me start. I was in the House of Commons. And I had actually just a few moments earlier spoken to Jagmeet Singh about the issue of racism in Canada and thanked him for his leadership on that issue, which I have done in the House of Commons, but I wanted to say that to him personally. I do think that Jagmeet, as the only racialized person who is the leader of a major political party in Canada, has a really important voice right now. And speaking as someone who isn't racialized, I think it's really not for me to say to a racialized person whether they've experienced racism or not. I think it's really important for us today. I think in Canada we've had a real wake-up call about racism in Canada. And it's time for us to acknowledge that there is systemic racism in our country, and it's time for us to act on it. I don't know if my colleagues want to.
I'm sorry, Elizabeth, it's one question, one follow-up.
There was a hand gesture apparently that that seems to be part of, I'm wondering if you saw any hand gesture on the part of Mr. Terrier.
I didn't see. I can't speak to kind of actual events that happened. I have pretty bad eyesight, so.
Thank you, Deputy Prime Minister. Kevin?
Deputy Prime Minister, I just want to ask you about the launch of the, what the Prime Minister spoke about today for the app for contact tracing. I know that at the beginning, when we first heard about this from the Prime Minister, there was a goal to really have a national app for everybody, with Ontario and Alberta launching their own apps before the federal government's ready. Is there an issue with timing here? Is this going to affect the rollout of a national contact tracing app, and its effectiveness?
Yeah, thanks for the question, because I can do something that doesn't always happen at press conferences, which is actually offer clarification. We are working very closely with Ontario and all the provinces, but specifically the app which will be piloted today in Ontario is the product of provincial-federal collaboration. And that app, which is going to first come out in Ontario, will be the basis of what we hope is an app that will be used across the country. We're working with other provinces closely on this, and the idea will be that it will be a true collaboration. So the interface at the top will be from your province. The data, which is anonymized, will be stored federally, and then that will have an interface with the local public health authorities. Now, it's going to be up to each province and the local public health authorities as to whether or not they want to be part of this. And provinces, many of them have been doing terrific work on their own apps and technology platforms. Having said that, I think we all appreciate that having a national app in a country where Canadians do travel could be really, really helpful. And so we hope we'll get to a point where all the provinces and territories are working with us on this. More details we'll hear just in 25 minutes from Premier Ford. And I do want to take this opportunity to thank Premier Ford and his team for the very great collaboration that we've had with them on this app, and I would say on contact tracing and testing in general. And maybe I should also point out Shopify and BlackBerry have been involved too. And I'm really glad that we have great Canadian technology companies who can work on this with us.
So, sorry, this Ontario app is the basis for the federal app?
It is the pilot of an app that will be available across the country.
If you don't mind, just for the privacy concerns, I know that there are, and I know that the government's trying to balance this. My question is, it's a Bluetooth-based app, so it locates proximity. So I have the app, someone else of the app has it, our Bluetooth realizes that we're within 2 meters or thereabouts. I'm sure that there's a margin of error. Will those interactions also be tracked for location, even though the location services of the app aren't on? So for example, will that data be able to know where that interaction took place, or is that part of the anonymity of this data, that it only tells you if you've come in a reasonably close contact with somebody who has tested positive? Basically, will the government get to know where you are and where you've been because of this app?
So, very good and important question. We're all going to hear more details as Ontario rolls it out today, but let me offer a few important points. The Privacy Commissioner has been involved. We have been working with the Privacy Commissioner on this, and I think it is entirely legitimate for Canadians to have these concerns. And I do want to also point to the work of our Minister of Justice, David Lametti, who in his pre-political career is a person who's done a lot of work on these issues as well. There will be no geotagging and no data collection. So I think, we believe it is important to work hard to protect people's privacy, and we believe that this app does that.
Thank you, Deputy Prime Minister. We'll now turn to the phone. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Marie Vastel du Devoir. À vous la parole.
Question from Marie Vastel, Le Devoir.
Marie, on va te revenir.
Oui, bonjour.
Yes, hello.
Pardon. Oui, bonjour, Mme Freeland. J'aimerais continuer sur ce sujet de l'application de la géolocalisation. Je veux juste savoir si vous pouvez en préciser en layman's terms, comme on dit. Je ne suis pas super techno malgré mon jeune âge. Si je comprends bien, l'application va retracer un contact via Bluetooth, mais ne dira pas nécessairement à quel endroit ce contact s'est produit et le gouvernement ne saura pas précisément, parce qu'il me semble qu'il y a forcément un certain aspect de localisation pour qu'on sache que 2 téléphones ont été à proximité. Ce que vous dites, c'est qu'il n'y aura pas la donnée GPS, dans le fond?
GPS data, is that what you're saying?
OK, merci pour la question et je vais essayer de répondre. Et j'ai l'excuse de n'être pas jeune. Et je dois dire que mes enfants disent que je suis une techno-idiote. Mais je vais essayer de répondre.
Really don't have this thing figured out, but I will try to answer your technical question.
On n'aura pas l'information dans le base des données, database.
This information will not be in the
base
database.
De données. On n'aura pas information personnelle.
There will not be
on
any
aura
personal
seulement
information.
un code anonyme.
There will only be an anonymous code.
Et si ton code anonyme est proche à un code anonyme de quelqu'un d'autre, le système va notifier les personnes si une des personnes sera testée positive. Alors, on a fait beaucoup de travail pour assurer la privacité des gens. Je suis très content que vous, les journalistes, posez les questions sur la privacité. Je pense que c'est très important. Et je veux vous assurer qu'on travaille fortement sur ça. On partage les inquiétudes et je pense qu'on a une app qui va préserver l'anonymité des Canadiens et Canadiennes.
Marie, en suivi.
Marie,
sur les provinces maintenant, c'est pas clair si toutes les provinces ont envie d'endosser cette application-là et d'y participer. Je comprends que l'Ontario, donc forcément, est impliqué, la Colombie-Britannique aussi. Pouvez-vous nous dire combien de provinces ou quelles provinces ont accepté d'embarquer dans cette application mobile et est-ce qu'il y a des provinces qui le refusent, notamment le Québec?
On est en train de discuter ça avec les provinces.
We are in the middle of some discussions with the provinces on that very matter.
Pouvez-vous élaborer un peu?
Question, can you elaborate a bit?
Non, je peux dire seulement qu'on est en train de le discuter. J'espère que ce pilote avec l'Ontario démontrera
à tous les autres provinces, aux Canadiens et Canadiens, aux Québécois et Québécoises, que c'est vraiment une bonne app, une app utile, et que ce sera possible pour nous tous d'avoir une app vraiment nationale. Je pense que nous comprenons qu'avec la relance économique, on commence de voyager plus autour du pays et avoir une technologie vraiment nationale nous aidera dans notre lutte contre le coronavirus. Peut-être, je peux ajouter aussi que nous continuerons d'avoir des bonnes discussions sur cette app avec les autres provinces, incluant par exemple la Colombie-Britannique. Merci.
Merci, Madame la Vice-Première ministre. Je crois qu'il nous reste une question au téléphone. Opératrice.
I think there's one question left over the phone. Operator.
The next question, la prochaine question, is from Jorge Barrera from CBC. Please go ahead.
This question is for Minister Miller. I'm just wondering about the situation with the child welfare prevention funding that's been denied in Saskatchewan, about $25 million to First Nations agencies there. Why is the department denying this funding, and why has it moved back from its previous commitment to provide unlimited funding for preventive services?
Look, thanks for the question, Jorge, and I won't comment on the number itself. I think I need to go back with my department and dig into that particular decision. But I think the point is Indigenous Services Canada shouldn't be in the position of deciding what services get funded or not. Yet that's the reality that we face today. That's the reality that we've faced for decades. Court orders have told us to pay more so that we achieve substantive equity for Indigenous children. The budget of Indigenous Service Canada reflects it. If you simply look towards Jordan's Principle, this year's estimates that I spoke to yesterday reflect another increase of $200 million. And behind that number are children in need that need that substantive equity. But the decision-making process largely, and yes, there's consultation, but the decision-making process largely lies still with Indigenous Services Canada. And so if you recall the whole discussion and the point of putting into place C-92 to reform child and family services is for communities, First Nations, to draw down their sovereign right to self-determine what they do with their children, which is something like someone like I take for granted, yet it has not been granted to Indigenous peoples. In fact, children have been taken away. That's the reality that we face today. So C-92, which came into effect, as you well know, Jorge, because you cover this extensively on January 1st, put into place a mechanism where communities can draw down that jurisdiction. It takes a coordination agreement that has to get intricately negotiated, notably with respect to funding and elements that you've discussed. But that said, we do currently fund actuals for agencies, and at times there are disagreements when there are requests that come in, and that's the reality we face today. That's the reality that we're trying to overcome, particularly with putting into effect C-92 and ensuring that First Nations, Indigenous communities draw down that fundamental right to have control and custody over their children, because they know best how to educate them, and the outcomes are there, and they prove it time and time again. But again, with respect to that funding, Jorge, that is something that I will be looking into. Thank you.
Follow up.
And as a follow-up to the Minister or Dr. Wong or both, I'm just wondering if the current, some are calling outbreaks, others are calling clusters of COVID-19 cases in two Northern Ontario First Nations. One is a Flying, the other one is a cluster of the highway. Is raising any alarm bells in the department, considering that it's believed that these are likely caused by community transmission and contact tracing is ongoing. But I'm just wondering if this is raising some alarms in the department.
I will pass it over to Tom because he does have the specifics, Jorge. And yes, any indication of a positive case is of extreme concern, particularly in a northern and remote community. You recall that particularly in Ibmatong, the community was very, very successful in being able to stamp out a concerning number of positive cases. The detection of a positive case is only one indication, and the important thing in communities is to isolate, track, and make sure that information is getting out so that people can stomp it out quickly. And when communities have been able to do that, they've been very successful. With respect to these two cases in particular, we do have some questions, but I think the answer that Tom will give you will reflect that. But it's still an ongoing process in trying to determine the reliability of that particular test.
Thank you very much, for your question. When you look at, in other jurisdictions and other locations, whenever there's a first case being detected, this is a signal that, a number of public health measures need to be implemented. And, we are so glad that the community is getting behind, working together with public health officials, both in the province as well as in Sioux Lookout health authorities, in order to make sure that all of the public health measures in place, including rapidly trying to test and isolate where necessary. And we've seen that in other jurisdictions where that's actually being implemented within a very short time, the virus stops propagating. And this is the outcome we want. Thank you.
Thank you, Doctor. Ceci met fin à la conférence de presse pour aujourd'hui. Merci tout le monde.
Thank you. Merci.